sponsored by Contech Incorporated. This year's nominees in the category of Technology Development. OKRA Medical.
When you turn on the news, you look on the internet, there's an article every single day, a news report every single day about the opioid problem. Kids, teenagers, go to people's houses and take the drugs out of their medicine cabinet that were left over from some other prescription, become addicted. And then that leads to heroin or fentanyl when they can't get the opioids.
One of my closest friends actually went down the path of addiction. Started with a car accident, got prescribed opioids, could no longer afford them. So he went to street drugs, heroin, and so he went down that path, and I watched him do it. So it was something that hit close to home. So if we limit access of these substances, we think we'd actually, not solve this epidemic, but make a pretty good dent in it.
OKRA Medical has developed a product that can denature Schedule II drugs and make them non-hazardous to be able to dump into a landfill. I don't think anybody's ever tried to destroy drugs other than incinerate them. It's been the only solution.
Currently, the DEA only allows their DEA registrants to reverse distribute and incinerate these items. That's a very costly thing to do. So it's also not very environmentally friendly. Safe Med Waste limits access to these controlled substances and these addictive substances in several different arenas where controlled substances are held or housed or prescribed are no longer needed. In developing this product, we wanted a few things. We wanted it to be easy to use, cost-effective, and environmentally safe. So we contracted an analytical lab, FDA-licensed, DEA-registered laboratory to help us in this endeavor. So fentanyl was the first drug that we chose to tackle, and we hit it with a bunch of different chemicals, and we looked at the products of those reactions. We did that with all Schedule II drugs with a variety of chemicals, extrapolated the data from that, and formulated a working solution, and that solution is Safe Med Waste.
My name is Jim Matthews. I'm a retired DEA agent and a retired sheriff. DEA has two basic main components. That's special agents who deal with the typical drugs that we all talk about. But then we have diversion, which tries to prevent the diversion of legal drugs, to try to keep that out of the illegal market. With the current opioid crisis, that's been a huge, huge problem for not only DEA, but for local law enforcement. When I was asked if I'd be interested in working with OKRA Medical, they flew me up to this independent lab, and it was important to me that it was an independent lab. I'm kind of a skeptic at heart. While I was there, I kind of got one of the chemists off to the side, and I said, "Does this stuff work?" And the guy said, "Yeah, it does." Any facility that can prescribe controlled substances, it could be a veterinary clinic, it could be a physician's office, they have a huge problem in getting rid of their waste. Safe Med Waste, I think it's a win-win for everybody. It's way cheaper than incineration. It works, and it's environmentally safe. So I think it covers three very important bases.
130 people die daily in the United States from drug overdose. If we could curtail that number and decrease that a little bit by limiting access to these substances, I think we won. We made a difference.